Hey guys, Dr. Utash here, and over the last few months, if you're like me, your diet has maybe not been quite what it should be. So I want to kind of get back to the basics here. Normally, we would hold a fantastic celebration, potluck, and talk about sugars, fats, and toxins, but since we can't gather like that yet, I want to do that over the internet. So over the next few videos, we're going to talk about sugars, fats and toxins, what to eat, what to avoid, how to get your nutrition back on track, and then some helpful hints and tricks along the way. What we use in our household, even for feeding our 2 and 6-year-olds. So Dr. Utash, sugars, fats, and toxins, the videos are on their way. Hey guys, Dr. Utash here, Wellness Key Chiropractic. Time to refocus on nutrition. Let's start with sugar. So sugar, we all know that we eat too much. We all know it's bad for lots of reasons. Let's kind of dive in deep so that way it really kind of burns a little spot in our brain. So the next time we pick up that sugary thing, we know what that's going to lead to. So first of all, sugar is one of the main causes of obesity, right? Excess sugar turns into fat. The worst time that you can consume sugar would be late at night because your body doesn't have any time to burn it off. And so it's going to store any excess sugar calories, simple sugars, as fat, typically around the midsection, which is the not so good fat, right? Second thing, sugar increases the acidity in the body. Most disease thrives on an acidic environment, so sugar does not help that cause. Number 3, inflammation. Again, inflammation, all those aches, the pains, those things that are annoying. If you're a new patient here, certainly you probably came in with some sort of problem, ailment, issue that's been bothering you. One of the best ways to recover faster is, of course, stay on your track with your adjustments, but then cut the sugar. As you cut the sugar, you're cutting inflammation, your body's able to speed up the recovery and the healing process. Sugar is obviously the prime reason for high cholesterol. Cholesterol is almost like a spackling, and so your body produces more cholesterol to tackle inflammation. Inflammation, of course, is driven up by excess sugar and stress. Sugar causes hormonal and metabolic imbalances, metabolic syndrome, and so again, one more reason we don't need, especially if you're going through menopause or puberty, not a great time, or maybe even certain times of the month, those are not great times to have excess sugar. It's going to have bad effects on your hormones. Fast track to diabetes. Obviously, excess blood sugar, you're going to burn out your insulin receptors, you're going to burn out your pancreas. Again, that leads to diabetes. In fact, we have more type 2 diabetes, which used to be called adult onset. We can't call it anymore because of the large amounts of sugar that people are consuming on a regular basis. And then sugar is a known toxin. There's an entire 60-minute video on that, on sugar is actually a toxin to the body when it's consumed, as many Americans are consuming it right now. Heart disease, again, for the fact of inflammation and acidity. Again, you're going to have less pliability of the blood vessels, and so you're going to have more issues with heart disease. And of course, it's an anti-nutrient. So when you consume a lot of sugar, your body actually has to work harder and dump out minerals and other things that you actually need in your body to help you dispose of that sugar properly if you can. And of course, sugar feeds cancer. Sugar promotes cancer. We've known this for decades now. We know that cancer cells have more sugar receptors, and so we know that when we have PET scans and we inject radioactive glucose into you, it goes to the quote-unquote hot spots. Those are those cancer spots inside the body, and so we know the best way to kind of set yourself up to be a cancer killer, a cancer fighter, is to reduce the amount of sugar that you're consuming. So if sugar is that bad, what's worse than sugar? And it's the fake sugars. And so maybe you're already a health nut and you've been doing protein powder, but you look in there and you see it's full of aspartame or sucralose. These fake sugars, they try to trick your body into making it sweet, but that trick doesn't work, right? And so whether it's leukemia and lymphoma, again, look it up. You'll see that there's a greater incidence of those people who are consuming those diet drinks. They have a greater incidence of those types of cancers, headaches, seizures, sleeping issues, all from these artificial sugars. So sugar's bad. What's worse than sugar? Those artificial stuff. Check us out on the next video as we talk about toxins. Hey guys, Dr. Utash here. We've been talking about sleep, and you're probably wondering what these awesome looking things are. These are my blue blocker glasses. As I was doing research on how to sleep better, not only for myself, but for patients years ago, came across the idea of blocking the blue light sometimes even hours before bed. And so this is part of my personal nighttime routine, is grabbing my blue blacker glasses and sometimes even before dinner, putting them on, and I really notice the effect before I go to bed. I'm much sleepier and I end up falling asleep quicker. So blue blocker glasses, you can get them on Amazon. I think these were $8. They're super stylish, right? But blue blocker glasses are what you need. Block the blue light, go to sleep faster, sleep better. Dr. Utash, Wellness Key Chiropractic. All right, does this posture remind you of anybody? If it does, great posterior chain activation. So as you get out of your chair, I encourage you to take breaks frequently. All the way up, squeeze the glutes, the buns, squeeze the scapula together. We're not leaning back, but we're squeezing these together for 20 seconds. So an extension, pulling them back, squeezing the buns, 20 seconds. That's gonna help open you up and stabilize your posture. Right, guys, today we're gonna talk about focusing on keeping your core tight. One of the things that you can do that is planks. And so when I say plank, sometimes, some people's ears just automatically shut off. I can't do a plank, never been able to do a plank, blah, 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 right? So I wanna show you some simple things that you can do to start engaging your core, strengthening your core so that you too will be able to do a plank. And we can go, we'll start with kind of the basic, easiest way to do a plank, and that's against the wall. So whether it's literally just leaning, right? Your stomach is engaged, your glutes are engaged, and your chest is engaged. Your head is in neutral position, and you're gonna hold this for 15 to 30 seconds, right? Next, you can do the same thing, but on a chair, right? If that becomes easy and simple, we can switch that to doing a kneeling plank. So heels together, on your elbows, tight tummy, no butts up in the air, no sagging tummies. So nice, straight, even plank. You might have to have a partner help you out with this and help hold and strengthen your core. And hold this again. Start with 15 seconds, work up to at least a minute, and then switch to the next level. Next level would be moving onto your toes, right? And then eventually, one leg, right? And then eventually, make it more challenging by going on an unstable surface, right? This will really get the shoulders, the core, the abs engaged. And again, if you could do this for 5 to 10 minutes every single day, 60 seconds on, 15 seconds off, you're gonna have an amazing core, right? Which is gonna help hold your adjustments and you're gonna get better faster. Dr. Joe Utash, Wellness Key Chiropractic.
All right, so you've just been diagnosed with degeneration or arthritis. What does that mean? What does it look like? Can and should you get adjusted? So a normal vertebra, a bone, a disc, and a bone. That disc creates a hole and a space for the nerve to come out. The bone is nice and smooth, right? The disc is fat, juicy, and plump. The fatter that disc, the bigger the hole for the nerve to come out. Now your brain is able to communicate down the nervous and through the nervous system to every organ, cell, muscle, tissue inside your body. And the neck, that's a nice curve, and you can kind of see those discs in between each of those vertebrae. That's normal. Phase 1 degeneration or arthritis is when that spine comes out of its normal position when we're talking about the spine. You might see that disc start to get a little thinner, which now we have more chance of nerve interference, stress, or pressure because that alignment of that hole is going to be a little smaller, right? So it's more likely to become pinched or subluxated and affecting that nerve flow or that flow of information. That's phase 1. Phase 2 is where we oftentimes call it arthritis, and that's when we're really going to see the changes, the big changes on x-ray with osteophytes, aka bone spurs, on the bones themselves. So now we start to get these lips, these beaks. The disc now is much smaller. Because that disc was unstable in phase 1, our body is always smart, and so it's trying to stabilize that joint by literally trying to fuse it together. As that disc gets smaller, that hole, that opening for the nerve to come out, also gets smaller. So these are the nerves that are going into your arm, or down into your leg, or for that matter, to your GI system. If that hole is getting smaller, there's less room for that nerve to get out, and so that communication is decreased. And it's much more likely for you to have a problem in those end muscle tissues and organs. Phase 2, if left uncorrected, unfortunately becomes phase 3. This is where there's very little disc space. Typically we have multiple units affected, and so with less disc space, we have almost a complete fusion where these bone spurs, these lips, these beaks are even bigger, right? It's almost a fusion. There's very little motion in that joint, and these nerves are absolutely going to be affected. It might be pain. At this point, it's because this process takes decades to happen. We may have gone from pain or a lot of acute pain to now it might just be where that part of the body just no longer has its function. So if those are the nerves that are going to your arm, you might notice that your hands, the muscles of your hands have decreased in size, decreased in strength, so that they're just not functioning at even close to 100% because there's been so much pressure for such a long period of time on the nervous system. So when can a chiropractor adjust you? Is it just when you're normal? Is it just phase 1 or phase 2? We can't touch phase 3? Well, certainly a chiropractor can adjust you in all of these, although obviously the best choice is to get it before the degeneration happens. So after an accident, an injury, a fall, a problem, when the spine shifts out of position, if that spine isn't shifted back into position, if we don't get normal motion in that joint, it goes through that process from that big healthy joint, and over time, months, years, decades, it degenerates, we get arthritis, and that's just the normal decay process. So if you want to keep this spinal joint healthy, keep the stress off the nervous system, allow your brain to communicate down the spinal cord, not those nerves, it's important at whatever phase of degeneration that you're in, that you get as much motion in there as possible, right? And that motion, again, increases proprioception, but it decreases some of the stress on that nervous system and allows your body to function. And motion in any joint is what keeps that joint healthy and alive. So whether you're in phase 3, phase 2, phase 1, or you're normal, that joint needs motion. And that the quicker you can restore motion to that joint, the healthier it becomes.